Hello, I'm Kristine Batty, a nurse practitioner, board certified in advanced diabetes management, and a certified diabetes care and education specialist. I'm also a person living with type 1 diabetes for over 40 years. My dual perspective allows me to bridge the gap between clinical expertise and real-world experience. As a provider, I understand the science behind diabetes management. But as someone who wears the tech, I know the daily challenges firsthand. One of the greatest innovations in the treatment of diabetes since insulin has been the continuous glucose monitor and insulin pumps. They're fabulous. They do so much for us, but they do come with challenges. Just like any screen, such as your cell phone, laptop, or tablet, we can experience data overload and alarm or alert fatigue. I remember when I began using a CGM with my insulin pump. I was totally overwhelmed by the alarms for a blood sugar over 180. In addition to the CGM alarms, I was being alerted by my pump for common things such as low battery and low insulin. Another issue that was a challenge for me using my devices was data overload. I was constantly looking at my CGM and became concerned about the glucose trends even when they were fine. I was continuously touching and looking at and adjusting my pump. Why is my alarm going off again? How come I can't keep my blood glucose less than 180? How am I failing at this so badly? Why am I always out of range? I became totally overwhelmed by all of the noise and information. And I felt as though I was doing a bad job caring for my diabetes since hyperglycemic alarms were telling me so. I know several people who have been so annoyed and overwhelmed by their devices that they stopped using them. People with diabetes using diabetes technology need to be honest with their medical provider about these challenges. Medical providers need to be evaluating for and discussing these issues. Let's discuss alarm fatigue first. Alarms on CGMs are a safety net telling us that danger may be coming, particularly hypoglycemia. As a medical provider, you need to make sure that you don't keep the device alarms on the default settings, especially the high alarms. It's one of the biggest things that we overlook. Ensure that the alarms are set realistically, or the person is going to become exhausted by their device because of having to constantly acknowledge and turn off the alarm and figure out what is happening. Not only does the alarm become exhausting, but it can create a feeling of failure. As a provider, I look at the alarm data as part of the data upload and ask, how often are the alarms going off? Are you being annoyed too much? Do you feel that an alarm adjustment is needed? If the alarms are going off frequently, the alarms need to be adjusted. But it may also mean that the treatment plan, such as the medication doses, also need to be adjusted. Now let's focus on the data overload. A few hints that data overload is a problem include complaints of being overwhelmed, of course, frequent intervention as noted by how often boluses are being given by the pump or how often the pump is being suspended. Also, lack of intervention may indicate being overwhelmed. I commonly ask the following questions. How often are you looking at the screen or touching the pump? How often are the alarms going off? Or if I see there are numerous alarms going off, how frequently is the bolusing on the data upload? And I ask the person to tell me about that. If I don't see many boluses being given, I really ask them to tell me about that. How are you adapting or coping with using the diabetes technology? Now, we certainly don't want people to stop looking at their blood glucose result at the time that they're due for their medications, or if hypoglycemia or hyperglycemia is suspected. Instead, stepping back to look at the trending over a 24-hour period and before a meal might be a way to reduce being overwhelmed by all the data. As a provider, look at the patient's data. If you see that a person is bolusing their insulin on their pump several times an hour, that needs to be discussed. As a person with diabetes, discuss with your medical provider your glucose targets and alarms. Know when to take a little bit of a break and step back. Give yourself grace. 3 takeaways. When a person is wearing a CGM and/or an insulin pump, alarm fatigue and data overload can have a negative effect. Set device alarms to be appropriate to the person wearing the device. Discuss the impact of the alarms and data with the person wearing the devices on how it impacts their daily life. For more information on this topic and other diabetes technology topics, please visit danatech.org from ADCES.